Welcome back to Morning Live, and as I told you earlier before we took a break, we want to talk about the oral health. Our sign language interpreter for now is Evelyn Wangui. And of course, World Oral Health Day is celebrated globally every year on March 20th, which is today, to highlight the importance of oral health for a healthy body. This year's slogan is Say Ah. Yeah, I'll repeat, say ah. You know, some people say ah, and of course, whatever comes out is very catastrophic. Act on mouth health. Now, government statistics from the 2015 Kenya Oral Health Survey found out that just 43% of people brushed their teeth once a day. Wow. And 9% brushed their teeth barely 2 times to 6 times per week, and 4% said they had never brushed their teeth. Now, about a quarter of the population said they avoid smiling because of bad teeth. Now, with me in the studio, I'm joined by Dr. Mercy Oira, who will be taking us through the R Day. Say R Day, that is actually the Oral Health Hygiene Day. And the statistics are very discouraging, that people who don't even brush their teeth. Daktari, what is happening?
Well, we have a very poor motivation from the people around Kenya to actually take time to brush their teeth.
Okay.
Most people find that it's something that just passes by in the morning. They don't need to do it. They don't see the importance of doing this.
Okay.
Yeah.
All right. Some people prefer to brush after supper. Some people prefer to sleep. Some people prefer to brush in the morning. Of course, a higher percentage, of course, brush in the morning, thinking they're going to meet so many people to avoid all this situation. But now people focus on the breath, not the hygiene, the overall health. Now, you can take us through that, actually.
Well, the oral health includes all the structures in the mouth.
Okay.
So when someone is brushing, they're supposed to actually brush the tongue, brush all the teeth, take their time, look at a mirror when you're brushing. Okay. And you see, brushing is both in children and in adults.
Okay.
So when you brush, first you need to have all the gadgets. You need to have your toothbrush and a good toothpaste. Yes, not the sticks. They are really traumatic to the gum.
Yeah.
So the incidence of brushing, like how many times you're supposed to brush? You're supposed to brush at least twice every day, and it should be done after meals. So it's not about brushing because you're going to meet someone.
Twice a day.
Yes, you're supposed to brush twice a day.
That's interesting, because I'm laughing because I know I'm surrounded by so many people who don't really brush twice a day. They do once. Of course, our director, Wadawara, is one of them. Faith McKenna is also one of them. And of course, so many people also in this situation do not do it twice a day. The biggest thing is always just we live for the moment. Like, for example, Daktari, of course, this morning you brushed. Are you assured that in the evening you also brush? You'll brush?
Of course.
Okay, interesting. Now, children, at what age should we start now taking care of their teeth? Because now there's so many theories out here. You use your fingers just to brush their teeth because it's still very young. Don't use maybe toothpaste. There's so many things maybe advised.
We have different methods of brushing the teeth for the kids. Let me start from the 0 years. The children who are still learning how to feed from, let's say, 6 months. That's when the teeth start coming out in the mouth, the lower teeth, for example. So a mother should take time to brush those small teeth with just a clean piece of cloth and water. Okay. And then now as they grow older now and start having multiple teeth in the mouth, now they can start introducing the small toothbrushes for the kids. And then there's also toothbrush for children. It's friendly. You just put a small piece size, just a small piece as you continue introducing slower. And then you see, the thing with kids is that when they see you brushing, they will also be motivated to brush. So you have to lead by example in the house, as a father, as a mother. Okay. Then now, as we graduate now, we have the adults. Now we have different textures of the toothbrush. We have soft, we have medium. When you go to the supermarket, you'll see the toothbrush is labeled S, M, and H. So the medium toothbrush is the one which is highly recommended because it doesn't damage the gum so much. And as long as you buy the toothpaste from the supermarket, whether it's Uncle Fresh or Colgate or Close Up,
brand it is,
as long as it's in the supermarket, it's a good, it has been standardized and tested by KEBS. You see, that's a good toothbrush. So as you take your time, you brush, looking in the mirror. And we also have gadgets called dental floss,
Yeah.
interdental brushing. We
Yeah.
use them to brush in between, if, for
Sure.
example, if you have spaces in the
Yeah.
mouth.
Yeah.
So you can use such gadgets
Gadgets, okay.
just to improve the hygiene in the mouth. And
Okay.
another thing, you also have to brush your tongue.
Okay.
Okay. Yeah, so that you avoid this bad smell that you're talking about.
Yeah. Yeah. Yeah.
Because even the food, when you're eating, it still touches the tongue. And the tongue also has some sort of puppy like things on the tongue, some projections.
Sensors, sensory nerves or something like that.
Yeah, they are
if I'm
nerves.
right. Anyway, there's this situation where the notion where kids who kind of had this bad odor are said to be sick. Sometimes one of the signs that they're unwell. Is it true?
Yeah, it's true. Because you see, the mouth is actually the window to your body. Like we are able to look at your mouth and we're able to see whether you have diseases. You might have, you might have even lesions in the mouth. They also signify whether you have disease. And you see children also who don't have good oral hygiene, most of them have very bad teeth. And they can, when you have bad teeth, it means either you have cavities or you have gum disease. And even if you look at the National Health Survey, Oral Health Survey, you find that so many kids, around 99% of the kids had gum disease, and about 46% had cavities in their mouth. And this translates to a poor quality of life. For example, a child not able to eat, a child has poor nutrition. You see, the consequence is just, it's like a chain. In the mouth.
Interesting. All right, self-esteem. You know, some students, even pupils, kind of some of them drop out of class because of self-esteem. And how should they tackle this? Because we're having a problem where, sometimes, you know, when your teeth turns brown, becomes a problem. You know, students actually, people say the truth. Mdomo yako inanuka, mane yako iko brown. You know what I mean? Sometimes it really lowers self-esteem, and then you drop out of school. You tell your parents you want to change that school, but of course it affects you. Should we start with also the parents now trying to be very careful on what they now teach, the culture of the hygiene to their kids, that is?
Yes, the parents have a very, especially the mothers, they have a very crucial role in teaching their children about oral hygiene. And it starts with the example set in the house, the standards you put in the house. Then again, we have, unfortunately, we have areas which have high fluoride levels in the water. Like the water is salty. So when the kids take it, it affects the structure of the teeth. We have a condition called fluorosis, in which you find like 41% of children have this condition. And like you said, it really has an impact on the self-esteem, because it's the way you appear, the way you smile.
Very
so
important.
People should be taught about seeking oral health. Like you should actually find time to visit a dentist so that they can give you some advice about how to deal with your issues. Some things can actually be corrected, some things can be modified, you know, so that we improve the way you look, so that you can even boost that self-esteem, because it starts at a young age.
It's true that.
Yes.
All right, you're taking a short break now. When you come back, Daktari will be telling us the processes whereby some people always advertise that tooth whitening cream, tooth whitening procedures. How is it done? And of course, we'll be talking about now the ailments. You know, as much as you're talking about hygiene, those diseases, and also the courtesy to tell someone, hey, mdomo yako inanuka kidogo, tafadhali fanya mambo. You know, those things actually have to touch on them. All that after a short break. All right, welcome back to Morning Live. This is hilarious because now another debate has actually just come in where dentists are taking advantage of your insurance cards. Trust me, that one tooth you want to get rid of, sometimes you charge 30K to get rid of it, and the cards are kind of really suffering. Anyway, let's talk about what's happening now. The ailments. we focus on the ailments before we talk about the courtesy. What are some of the conditions people kind of have and ignore? The generic requirement where you have to visit a dentist at least twice a year. I don't think so. I don't think so. I don't think so. What do you think? Because now for me, I'm a victim. I don't go.
Yes, it's a very big concern in our profession, because most people actually have teeth problems and they don't know. Okay, we have conditions like caries, which is basically cavities in the mouth.
Okay.
Like in children, you find like it's 34% of the children have cavities in the mouth, and even if they're baby teeth, they still need to be taken care of.
Sure.
Yeah. And adults, we also have cavities in adults. We have gum disease, which presents itself with, you know, like a bad smell or bleeding gums or swollen gums. You know, there are very many presentations. We also have like swellings or ulcerations, like growths in the mouth. You know, people take for granted and they're like, this one will just go away. But you see, these things, you actually have to visit a dentist, a health profession, so that they can give you medication. They can either do fillings. There's something called root canal, which we can do to preserve
Why
the
do you
teeth.
prefer root canal, actually?
You see, root canal is a treatment whereby we are trying to preserve the tooth.
Okay.
The tooth is actually dead in layman's terms,
sure.
but you see, you're able to retain it in the mouth. You can still chew with it. You can still smile because the tooth is still there. It is still maintaining the space and the bone in the mouth. You see, you're not losing your teeth, and you're able to eat all kinds of food.
All right, now discoloration also is one of this. It lowers self-esteem.
Yeah.
Solutions to this.
You see, when you have discoloration, you have to know first, why do you have it? Okay, is it because of the fluoride, like I mentioned earlier, the condition we have called fluorosis? Is it because of the stains that are usually on the teeth, because of the food you eat? Maybe it's a lot of coffee, a lot of tea, you see? So we have various remedies. We have something called scaling, full mouth scaling, and polishing, whereby we clean all that debris, we remove all that dirt that is also associated with gum disease. Okay, and then we have, of course, whitening procedures, different kinds of whitening procedures. We have something called masking, whereby we can actually cover that brownness that is on the teeth, right? Such that when someone is looking at you, the teeth appear white. It's only me and you who will know that there's actually a filling or a covering on the tooth, okay? And of course, we have the normal whitening procedures. We use a special gel to whiten the teeth, okay? And we also have there are many forms, okay? We have things called crowns, all right, which are like caps we put on the teeth, all right, so that we actually cover it completely. And they are white, they will look just like your normal teeth.
And the braces, some people like, okay, we used to call them grills, but of course, they kind of a strong kind of a foundation to just hold your gums. What are they used for?
Those are, they're called brackets, right?
Brackets,
There are different types. We have the metallic ones, nowadays we have ceramic ones, which are like a whitish, and we also have colorless ones. They are called Invisalign braces, So these ones aid in alignment of the teeth. You find that some people, when their teeth are growing, they didn't have space. So they have grown in different directions.
Wow.
Some are not in the correct position.
So that's a wiring process.
It's not wiring, it's alignment.
Alignment.
There's a science that we put to just adjust those wires.
Is there anything called wiring in dentistry?
It's not wiring. We use wires, but it's not called wiring. It's braces. It's basically orthodontic treatment. Okay, and it's done. It should be done with a professional. Yeah, someone who has gone to school, not those backstreet people. Yeah, because we have to calculate the space. We have to know how much we need to adjust and rotate this tooth so that it can actually align with the others. Okay. Yeah, and if it is done well, the results are super.
Wow, amazing. Now, the people who hit a certain age and they can't grow anything, and it's sometimes very traumatic when you know that at the front you can't actually have anything. So the dentures, are they called the dentures?
Yes.
Yeah, I'm right, right?
Yes, you're
the
very
dentures,
right.
Yes. How the dentures are actually administered in this situation?
Some people lose teeth because of different reasons, maybe trauma, maybe you fell down, or maybe you just removed because of, nowadays people just like removing teeth, either they have a hole or something. Now, when it comes to replacement, there are many forms of replacement. We have now like fixed fixed forms of replacement or removable. Now the removable ones are called removable dentures. Okay, we have to take measurements in the mouth, then we put the dentures. Okay, but we also have an option called
So the dentures are the ones people remove and put in a glass, eh?
yes,
Water.
yes, you put it in water at night. Okay, but there's an option called
Okay.
a bridge.
Okay, okay.
A bridge. Those are now the latest in the market. Okay, that's like way back. So right now we have
Yes.
a bridge, and we have something called an implant. Okay, these are now more advanced bridges. We use the neighboring teeth to support the missing teeth.
Okay.
So we'll fix it, and it will not move. You cannot remove it.
Is it true some people, maybe you get married, you don't know if someone has dentures, and then you realize later on in your lives that, hey, huyu mtu hakuwa na meno. Just one day when you're fighting,
That's when you realize.
Yeah, you realize.
Yeah.
Okay, these are stories out here. But now, for children, at what age do they start now losing a teeth?
First of all, children have different milestones. So do not give your child a rigid, a developmental pattern. But generally, we have the baby teeth start coming out from 5 to 6 years.
Okay.
The lower teeth. Okay, they come out first, and then the upper. They alternate like that.
Yeah.
Okay.
Yeah.
So by around 15 years, that's when we finish removing the teeth. Yeah.
All right. Okay. Now, when can you actually tell or know it's the right time now to go for this removal of teeth for those kids actually?
Removable.
Yeah. The right time. There's this time where a parent should actually know that it's the right time. I should take my kid to the dentist. They're losing teeth, and of course now she'll actually get rid of it. Yeah, sure.
Actually, teeth just come out on their own. They'll just start shaking. Yeah, the teeth will, the child will be uncomfortable, chewing. So if you shake the tooth every day, it will come out. But you see some.
It's not painful.
It's not painful.
Yeah, okay.
Yeah, some people use a string. Anyway, but we are here to help.
Yeah.
In case it's not coming out at the time,
sure.
right?
Yeah.
Maybe it has overstayed, or maybe you are noticing some other permanent teeth are growing from inside. You see, that's the time to especially go to a dentist. We'll put for them a very good localized anesthesia. They will not feel any pain when we are removing. Yeah.
And kuna hii shida watu wengi mdomo kunuka. Trust me, they can really brush like thrice a day, but there's a problem. Ukiongea nawe hivi tu ni tear gas. You know, like you're slapped with something, and then of course someone has tweeted here that kuna watu wananuka gas cooker. Not even the cooker, the gas itself, but he mentioned gas cooker, but the gas itself. But there's a problem. Let's not go to this problem. Yeah, there are people out here who really suffer.
Yeah.
And when you talk about kind of the smell, it's traumatic also. Sometimes when you are with people, you're trying to explain this point, but people are uncomfortable, just covering their noses. Please offer this help to these people.
Actually, the bad smell, it's called halitosis. Okay. And it's caused by many things. The first reason, the chief cause is the dental. Okay. We usually have food debris, like food, maybe the last night or the morning breakfast, that stays in the mouth, stays on the teeth, and then maybe hides between the gum and the teeth. If it happens over time, maybe like for 6 months, it accumulates.
So that food just for 6 months is just there?
It's still there. Your ugali is still there.
For 6 months?
For 6 months, okay?
Hey, okay.
So you can imagine, so this food attracts bacteria in the mouth, and now it causes an infection, all right? Either gum disease or maybe cavities in the mouth.
But why do you have this thing for 6 months, for God's sake?
You see, it usually hardens with time because of the presence of the saliva. The saliva has calcium,
so bacteria
ions.
Also...
it's just a combination of everything. Food debris, bacteria, saliva,
so it's a concoction of just tear gas.
It's everything combined together. Yeah, it's stuck on the stuck on the teeth. Yeah. So even if you brush out, because it's been there for a long time, it doesn't come out. So that's why you need to seek advice
dentist,
from a health professional, a dentist. They'll be able to examine. Actually, this dirt is called calculus. Before it really hadn't, it's called plaque, because you can actually scrap it off with your finger. But when it's hard, that calculus, that tartar that's in the mouth, we do now the scaling. All right, it's called scaling, the cleaning of the mouth. We remove every food, everything that is attached to the tooth surface.
6
And then now
months old.
and then now your teeth are now vibrant and fresh,
Absolutely.
and the gum is also able to rejuvenate.
Yeah, interesting.
And after that, now your mouth smells much better.
Much better,
yeah?
much better, of
And
course.
if you do this at least every 6 months, you see a dentist.
Okay.
You know, we are able to see
Yeah,
these things early,
yeah.
so that you don't suffer. You are there.
Okay.
Your colleagues can't even talk to you. You see.
Yeah. Now, another thing, some people are confused. Do I feel or kind of just remove it? The best option, actually. You tell us today, because it's always been a debate. Yeah, you have this cavity, there's a very conspicuous hole over there. You want to fill or remove it. Someone tells you, you kiziba, after a few months again, you'll have the same problem. So the best thing to do, just go get rid of it. Your best advice.
Preservation of the tooth is the best. You know, removing the tooth is like an old way of doing it. We didn't know that we could actually feel the teeth. So when you have a cavity, when you have a hole in the mouth, okay, maybe food is packing there, you're not able to clean properly, or you feel some sensitivity when you take something hot or cold on a certain area, it's good you go to the dentist. We'll do an x-ray. We'll be able to see exactly where the cavity is,
Sure.
and then we're able to do a filling.
Okay.
Depending on the extent, we'll either do a simple filling or we'll do something called root canal treatment.
Okay.
The goal nowadays is to preserve your tooth
preserve.
as much as possible.
Okay.
Because these teeth grow when you are 6 years old. We want you to stay with these teeth until you're 50, until you're 60. You eat your nyama choma, you eat your ugali very well.
Absolutely. Interesting. Now, I understand this doesn't concern you, but the courtesy to tell someone indeed you have a problem. Maybe is it calling them aside and talking to them, or now maybe just kind of in public and just shoot it in public, or maybe from the ethics angle, I understand the med school you went through. What's the best approach in this?
The best thing is to tell someone personally, on a personal level.
Kando.
You just tell them, you know, you're my friend. Yeah, there's this problem I've noticed. Have you ever thought about seeing a dentist? Have you ever seen a doctor? There are always solutions to the problems you have in the mouth.
Okay, wow, amazing. Early 20s, there's this problem that the tooth is growing at the end and the gum is very, very painful. You know what I mean, actually?
Yes.
What's the solution to this? Just painkillers and then life goes on, or you have to also to seek a dentist care, because it's always very, very, very painful. It happens, I think, from 20 to 25 or something like that. Yeah. What goes on here now?
This is because of the last teeth. They usually called third molars. Okay. They usually grow between the age of 16 to 25 years old.
Okay.
All right.
Okay.
And sometimes they don't have space. Maybe the other teeth have taken all the space.
Yeah.
Or they
so it's forcing itself to come out.
Yeah. So it's forcing. It wants to come out and.
Yeah.
So there's a lot of discomfort associated with that tooth. So basically, what we normally do, we advise at least our patients to come. We are able to check. All right. We're able to do an x-ray. We see the way the tooth is, the position of the tooth. Okay. And if it is positioned in a bad way, growing incorrectly, causing pressure on the neighboring teeth, causing all that pain, there's also some, we call them nerves.
Yeah.
Sometimes the tooth is pressing on the nerve there, such that you're feeling so much pain.
Yeah.
Okay.
Yeah.
So the best thing is to seek a dentist.
Okay. Also seek a dentist at that point.
Yes.
Because sometimes people are told just mess up painkillers and then life continues.
You see this chronic habit of taking painkillers.
Yeah.
Your body becomes resistant. Even if you take how many grams, you start having a dependency on a very high dose of a painkiller. So the natural and the best way is to at least get advice, get consult. Consultation is very cheap nowadays.
Now, finally, when you talk about genetics, some people lose teeth, back-to-back situations. Some people just okay. Do we have some genetics angle in this whole situation?
Yes, we have some people have generally weaker teeth, because of what the genes they inherited from their parents. So they're more susceptible to getting cavities, for example. Like the last teeth, when they're not growing properly, they're called impacted teeth. So when some people also, it runs in their family. So there's a genetic disposition.
Thank you very much, Dr. Mercy, for coming to the studio today. We really appreciate your sentiments. So many people have learned. SMS is actually coming in from Twitter. Of course, SMS is Twitter, and guys are hilarious about the order from your mouth, from people's mouth. But again, I'll just say, keep your hygiene clean, oral hygiene clean, and of course you'll have your self-esteem improve, and so many things will improve your life. Thank you so much, Daktari.
Thank you.
We're not taking a short break now. When you come back, you want to talk about the power of women who've actually now done so much in terms of keeping aside some of their daily routine to go bike, and of course keeping fit, making sure the societal welfare also sorted, and of course their health. All that coming to you after a short break.